look at this incredible journey right there. A group of healthcare heroes in Alaska racing to deliver the COVID vaccine to one of the most remote parts of the world. Planes, sleds, snowmobiles. This dedicated group of women will join us live in just a moment. First, Kana Whitworth has more on their inspiring story. Good morning, Kana.
Hey, George, good morning. So right now, across the state of Alaska, healthcare workers are battling sub-zero temperatures with just a few hours of daylight each day. They venture into rugged territory, even doing home visits when necessary to vaccinate village elders. They are true healthcare heroes, practitioners across Alaska flying to remote villages to vaccinate elders against COVID-19 and braving deadly conditions to do it. Based in Kotzebue, Alaska, 33 miles north of the Arctic Circle, this all-female team, a doctor, 2 nurses, and a pharmacist, board a bush plane. They're flying with the vaccine in hand to small villages of just 200 people, largely cut off from the rest of the world. If the teams didn't make these trips, some of the people would have no way to get the vaccine. Once they land, villagers drive out to them on snowmobiles. The women load up in a sled and are pulled the rest of the way into the village. In one day, this team traveled hundreds of miles, vaccinating 65 people. In the past month, various teams have made about 30 of these trips, all part of the commitment these healthcare professionals make to service rural villagers who will not be forgotten. Now, these women are part of a healthcare team dedicated to servicing 11 villages in northern Alaska. They do so year-round with a smile on their face. And you guys, I've thought that maybe I've had a challenging day at work. I'm going to go ahead and walk that back after talking to these women. Yeah, it's just incredible. Okay, thanks very much. Let's bring in Dr. Katrina Bengard, pharmacist Dr. Meredith Dean, and registered nurses Heather Kennison and James Austin V. Thank you all for joining us. We love your story so much. And Dr. Bengard, let me begin with you. You recently did a home visit to vaccinate a 92-year-old woman. Tell us about the challenges you faced to get that vaccination to her.
Sure. And Uva Lotuk, that's Inupiaq for good morning. It was wonderful to be able to offer the vaccine, not just to the people that were able to make it into the village clinics, but also into homes of elders who were homebound. This particular patient was somebody whose parents survived the 1918 flu. And so it was really important for her family that she be vaccinated so that she'd be given a better chance through this pandemic. The 1918 flu was really devastating to some of the communities up here. And it was just wonderful to be able to offer that to her.
Wow, just such an incredible story. And Meredith, I know you're a pharmacist. Tell us about your role on the team and the challenges that you guys faced working in these sub-zero temperatures.
Yeah, it's challenging getting the vaccine up here to begin with, and then getting it out the villages brings on a whole new set of challenges and logistical issues. So once we got the plan in motion to get out to the villages, it then becomes kind of a matter of time. By the time I let it on thaw and dilute the vaccine, I'm drawing it up for our nurses to give. So then I have 6 hours once it's unthawed to use this vaccine up. So, you know, time is of the utmost importance. And I'm carrying an anaphylaxis kit with me to make sure, you know, in case we have any reactions, that we're ready to be there.
The big responsibility. And Heather and James, we know you're nurses, but you actually administer the vaccine as well. And Heather, I understand that you have to hold the vaccine in your arm sometimes like a baby to keep it the right temperature.
Yes, when Dr. Bengard and I went out to the 92-year-old elder, it was packaged by Meredith, and I got into the back of a sled behind a snow-go and carried it like it was a baby in my arms so that we could get it to the elder and make sure that she was able to be vaccinated appropriately.
And James, you're visiting such isolated villages there across Alaska. Walk us through what that journey looks like in an average day.
Ooh, well, this was a 3-village day. So we got to go from car to commercial airline Bering Air, got picked up at a snow-go with a sled behind it. Then we got on Charter Air, Golden Eagle Outfitters. Then we got picked up by a 4-wheeler with a little trailer behind it, more snow-goes, more sled. And it's actually more navigable out here in the winter than it is in the summer because you can travel on the tundra and all the water turns to navigable ice. And it's just like your cars and subways and buses in lower 48. This is just how people get
It's
around
actually
here.
nothing like that at all.
You guys win, for the record. You definitely beat us on this one. Katrina, you were saying that, tell us more about what it's meant for your patients to get this vaccine. What's been the reaction to your visits?
You know, the biggest reaction we got was that the patients were grateful, grateful that we were able to come out to see them, also grateful that they were getting it so timely. They were getting it right at the beginning when we had the vaccines, oftentimes earlier than the lower 48. So it was really a pleasure for all of us to be able to offer that to them.
And we know that you all are somewhat new to Alaska. Meredith, you're from Tennessee. So what has it been like going from the south to just about as far north as you can get?
It's been pretty surreal. I moved up here because I knew it would bring on a whole new set of challenges, and I was interested in that. And then you get here, and sometimes you feel like you're living in a snow globe. Completely surreal. It's amazing, all the modes of transportation and learning about the culture. Such an opportunity and experience that I don't think really any of us take for granted.
What does it mean to you to be part of an all-female team, James?
It is an absolute delight, and we are all also committed to actively working towards a world where that is not remarkable. I want to mention the community health aid practitioners who are mostly female, and it's an Alaska-specific program, the CHAP program. They are the primary care providers in the rural village clinics. They pick us up on the snow-goes. They organize everything to get the paperwork dialed in. We could not do it without the CHAPs.
Well, I can see you all nodding your heads. You're such a special team. You're doing such important work. Thank you so much for your work, and thanks for joining us this morning.
Thank you.
Thank you.
Take care.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.